High blood pressure, the silent killer unveiled. Welcome to the U.S. Health Guide, where we're dedicated to providing reliable and easy-to-understand health information to help you make informed decisions for your well-being. Today, we're diving into a common, yet often underestimated health challenge: high blood pressure, medically known as hypertension. The invisible threat. High blood pressure is a widespread global health challenge, so common that it's often underestimated. It's estimated to affect up to 40% of adults, making it one of the most frequent reasons for prescription medication. Alarmingly, many people are completely unaware they have it. The chilling nickname, the silent killer, is precisely given to high blood pressure due to its insidious nature. This condition rarely shows obvious symptoms, even as it relentlessly causes significant internal damage. The absence of clear warning signs allows this condition to progress unchecked, gradually leading to serious and potentially life-threatening health complications over time, including heart disease, heart attacks, and strokes. The profound danger lies in this very paradox: a disease that causes no immediate discomfort or overt signs, yet silently erodes physiological integrity, leading to severe organ damage. The lack of early indicators can create a false sense of security, delaying diagnosis and intervention until significant, possibly irreversible harm has occurred. This crucial understanding underscores the urgent need for proactive screening and awareness, as waiting for symptoms to appear often means the disease has already advanced to a critical stage. Our goal at the U.S. Health Guide is to shed light on this hidden threat, equipping individuals with the knowledge necessary to safeguard their long-term health. Understanding the numbers. What is blood pressure? To effectively address high blood pressure, it's fundamental to understand what the readings mean. Blood pressure is essentially the force that circulating blood exerts on the inside walls of your arteries. While it's perfectly normal for blood pressure to fluctuate throughout the day in response to activities like physical exertion or emotional stress, consistently high readings, even during periods of rest, signal an underlying health issue. A standard blood pressure measurement consists of two distinct numbers: systolic blood pressure and diastolic blood pressure. Systolic pressure, represented by the top or first number, quantifies the pressure in your arteries during a heart's contraction phase, specifically when the heart's left ventricle pumps blood into the circulatory system. Conversely, diastolic pressure, the bottom or second number, reflects the pressure in your arteries during the relaxation phase between heartbeats, when the heart's left ventricle refills with blood. These measurements are typically expressed in millimeters of mercury, abbreviated as mmHg. Understanding blood pressure classifications is paramount for proper diagnosis and guiding appropriate treatment strategies. Normal blood pressure is characterized by a systolic pressure below 120 millimeters Hg and a diastolic pressure below 80 millimeters Hg. Elevated blood pressure is defined when systolic pressure falls between 120 and 129 millimeters Hg, while diastolic pressure remains under 80 millimeters Hg. This classification indicates blood pressure is slightly higher than ideal and serves as a precursor, increasing the likelihood of developing chronic high blood pressure. Hypertension, or high blood pressure, is diagnosed when systolic pressure consistently reads 130 millimeters Hg or higher, or diastolic pressure consistently reads 80 millimeters Hg or higher. This condition is further stratified into stages to aid clinical management. Stage 1 hypertension is defined by a systolic pressure of 130 to 139 millimeters Hg, or a diastolic pressure of 80 to 89 millimeters Hg. Stage 2 hypertension is diagnosed when systolic pressure reaches 140 millimeters Hg or higher, or diastolic pressure is 90 millimeters Hg or higher. A specific manifestation, particularly common in individuals over 65, is isolated systolic hypertension, where the diastolic reading remains normal, below 80 millimeters Hg, but the systolic reading is elevated. Blood pressure readings exceeding 180 to 120 millimeters Hg signal a hypertensive emergency or crisis, demanding immediate medical intervention. A definitive diagnosis of high blood pressure is typically based on the average of 2 or more readings taken on different occasions, accounting for natural daily fluctuations. A significant shift in medical guidelines, notably by the American Heart Association, recently lowered the threshold for hypertension from 140 to 90 mm Hg to 130 to 80 mm Hg. This adjustment is more than a technical revision. It's a profound reevaluation of risk. This reclassification holds substantial public health implications as it broadens the number of individuals identified as having elevated blood pressure or hypertension. Consequently, it expands the window for early intervention through lifestyle modifications. By identifying at-risk individuals sooner, healthcare professionals aim to prevent progression to more severe disease stages and avert associated complications. This proactive approach, while potentially increasing initial diagnoses, ultimately serves to emphasize heightened vigilance and encourage timely preventative measures, shifting the focus to earlier risk management rather than waiting for higher, more dangerous thresholds to be reached. Hidden impact: complications of uncontrolled hypertension. The insidious nature of high blood pressure becomes most evident in the severe consequences of leaving it untreated. When blood pressure consistently remains excessively high, the relentless force on arterial walls gradually damages blood vessels and vital organs throughout the body. Crucially, the longer high blood pressure remains uncontrolled, the more widespread and severe the damage becomes. This cumulative erosion of health, often occurring silently, underscores the profound danger of the condition. The heart, the central pumping organ of the circulatory system, bears a disproportionate burden. Persistently high blood pressure forces the heart to work significantly harder to circulate blood. This increased strain can lead to a thickening of the heart's main pumping chamber wall, a medical condition known as left ventricular hypertrophy. Over time, this thickened heart muscle can lose its efficiency, struggling to pump enough blood to meet the body's metabolic demands, ultimately resulting in heart failure. Sustained high pressure also contributes to the hardening and narrowing of arteries, a process known as atherosclerosis. This arterial stiffening significantly increases the risk of acute cardiovascular events, such as a heart attack or stroke. Furthermore, sustained pressure can weaken sections of blood vessel walls, causing them to bulge and form aneurysms, a potentially life-threatening condition if one ruptures. Beyond the cardiovascular system, high blood pressure severely impacts other critical organ systems. Kidneys, the intricate network of blood vessels within the kidneys essential for filtering waste products from the blood, can become narrowed or weakened by high blood pressure. This impaired function leads to kidney damage or, in severe cases, kidney failure. Various kidney diseases, including those stemming from diabetic complications, diabetic kidney disease, polycystic kidney disease, or renal artery stenosis, renovascular hypertension, can directly cause or significantly worsen hypertension. Brain. Uncontrolled hypertension can reduce blood flow to the brain, impairing cognitive functions. This can manifest as changes in memory or comprehension and can even lead to a specific form of dementia known as vascular dementia. Stroke, involving an abrupt interruption of blood flow to a part of the brain, is another devastating neurological consequence. Eyes. The tiny, delicate blood vessels supplying the eyes are also vulnerable to the impact of elevated pressure. This can cause them to thicken, narrow, or even rupture, potentially leading to vision loss. High blood pressure is also a central component of metabolic syndrome, a cluster of interconnected disorders signaling a high risk for serious health problems. This syndrome typically includes increased waist circumference, elevated triglycerides, low, good HDL cholesterol levels, and high blood sugar, in addition to high blood pressure. The presence of hypertension significantly escalates the likelihood of developing other components of metabolic syndrome, thereby amplifying the overall risk for diabetes, heart disease, and stroke. This comprehensive view reveals that high blood pressure is not merely a localized heart problem, but a systemic, whole-body disease. The damage it inflicts is cumulative and often interconnected, meaning that impairment in one organ system, such as kidney damage, can directly exacerbate issues in another, like heart failure. This intricate web of causality reinforces the silent killer narrative by illustrating how it silently and comprehensively erodes overall physiological integrity, leading to a cascade of serious, often irreversible health issues across multiple body systems. This underscores the paramount importance of holistic health management and early intervention to prevent this widespread systemic deterioration. Discovering your risk. Who is vulnerable? Understanding the factors that contribute to an increased risk of high blood pressure is a critical step towards effective prevention and management. High blood pressure is typically classified into two main types: primary hypertension and secondary hypertension. Primary or essential hypertension is the most common form, usually developing gradually over many years without a specific identifiable cause. Its exact etiology remains fully understood, but it's believed to arise from a complex interplay of genetic predispositions and various environmental factors. Conversely, secondary hypertension is characterized by an identifiable underlying medical condition or the use of certain medications that directly cause high blood pressure. This type of hypertension can often be resolved or significantly improved if the underlying cause is successfully treated. Potential underlying causes of secondary hypertension include a range of kidney conditions such as diabetic kidney disease, kidney damage from diabetes, polycystic kidney disease, a genetic disorder causing cysts in the kidneys, or renal artery stenosis. Renovascular hypertension can significantly raise blood pressure by impairing the kidney's ability to regulate fluid and salt balance. Dysfunction of hormone-producing glands can lead to hypertension. Examples include adrenal gland disorders, such as Cushing's syndrome, where the body produces too much cortisol, aldosteronism, characterized by excess aldosterone leading to salt and water retention, or pheochromocytoma, a rare tumor producing excess adrenaline and noradrenaline, or thyroid problems, both hypothyroidism, a deficiency of thyroid hormone, and hyperthyroidism, excessive thyroid hormone. Hyperparathyroidism, affecting calcium levels, can also contribute. Other medical conditions such as obstructive sleep apnea, a condition where breathing repeatedly stops and starts during sleep, and certain congenital heart defects affecting blood vessels can also be culprits. Numerous medications, both prescription, including some birth control pills, over-the-counter cold and sinus remedies, certain pain relievers, and illicit drugs like cocaine and amphetamines are known to induce secondary hypertension. In addition to these specific medical conditions, several risk factors, some controllable through lifestyle choices and others inherent, increase an individual's likelihood of developing high blood pressure. Controllable risk factors, lifestyle choices include obesity or being overweight. Excess body fat significantly increases the heart's workload, puts extra strain on blood vessels, and directly contributes to elevated blood pressure. An unhealthy diet, particularly one that is excessive in sodium, salt, and deficient in potassium, can contribute significantly to elevated blood pressure. It's noteworthy that a large proportion of modern dietary sodium originates from processed and restaurant foods. Physical inactivity. A sedentary lifestyle not only predisposes individuals to weight gain, but also directly impacts blood pressure regulation. Regular physical activity is crucial for maintaining a healthy heart and blood vessels. Excessive alcohol consumption. Drinking too much can elevate blood pressure. For men, this typically means more than 2 alcoholic drinks per day, and for women, more than 1 per day. Tobacco use. Smoking, chewing tobacco, or even consistent exposure to secondhand smoke all directly damage the heart and blood vessels, with nicotine acutely increasing blood pressure, while carbon monoxide, a byproduct of tobacco combustion, reduces the blood's oxygen-carrying capacity. Chronic stress, prolonged periods of unmanaged stress can contribute to sustained high blood pressure. Insufficient sleep. Regularly missing out on quality sleep has been linked to an increased risk of developing high blood pressure and other cardiovascular problems. Uncontrollable risk factors include age. Blood pressure naturally tends to increase as individuals age, raising the risk for nearly 9 out of 10 Americans over their lifetime. Family history and genetics. A strong family history of high blood pressure significantly increases an individual's likelihood of developing the condition, suggesting a genetic component. Race or ethnicity. High blood pressure is particularly prevalent among Black individuals, often developing earlier in life and with greater severity compared to other racial groups. Sex. Women and men are equally likely to develop high blood pressure at some point in their lives. Certain chronic conditions, beyond those directly causing secondary hypertension, such as diabetes and obstructive sleep apnea, can independently increase the risk of developing high blood pressure. Pregnancy. Some women experience the development of high blood pressure during pregnancy, a condition that can pose risks to both the mother and the developing fetus. A critical understanding emerges from the interplay of these factors. The risk of high blood pressure can significantly amplify when genetic predispositions or uncontrollable factors combine with unhealthy lifestyle choices. This means that while certain inherent traits like genetics or age might predispose an individual to high blood pressure, they don't dictate an inevitable outcome. Instead, these genetic factors make diligent management of controllable lifestyle factors all the more imperative. For example, an individual with a strong family history of hypertension should view the adoption of healthy habits not just as beneficial, but as an essential and proactive defensive strategy. This perspective shifts the narrative from a fatalistic, "it's my genes, there's nothing I can do," to an empowering, "my genetic blueprint highlights the importance of being even more vigilant with my lifestyle choices," thereby emphasizing individual agency within a given genetic context. Taking action, diagnosis, prevention, and management. With high blood pressure often presenting without symptoms, taking proactive steps for diagnosis, prevention, and management is critically important. Diagnosis, uncovering the hidden threat. The sole method to determine if an individual has high blood pressure is through regular blood pressure measurement. This routine checkup is a simple, quick, and generally painless procedure. During a blood pressure reading, a healthcare professional typically places an inflatable cuff around the upper arm. It's crucial that the cuff fits correctly, as an ill-fitting one can lead to inaccurate readings. For the most accurate measurement, it's advisable to avoid smoking, strenuous exercise, or caffeine consumption for 30 to 60 minutes before the reading. Individuals should sit comfortably with their feet uncrossed and their arms supported at heart level. During the initial evaluation, blood pressure should be measured in both arms to identify any potential discrepancies, and subsequent measurements should always be taken in the arm that yielded the higher initial reading. A diagnosis of high blood pressure is typically established based on the average of 2 or more readings taken on different occasions. If initial readings are high, the healthcare provider will likely recommend follow-up tests, spaced about a week apart, acknowledging that blood pressure can naturally fluctuate throughout the day and from one day to the next. The healthcare provider will also thoroughly review the individual's medical history, inquire about any subtle symptoms, and delve into lifestyle habits such as diet, exercise routines, alcohol consumption levels, and smoking status, as well as family history of cardiovascular conditions. If high blood pressure is diagnosed, additional diagnostic tests may be recommended to investigate potential underlying causes or assess for potential organ damage. These supplementary tests might include laboratory blood and urine analyses to evaluate cholesterol levels, blood sugar, and kidney, liver, or thyroid function. An electrocardiogram, ECG, or EKG may be performed to measure the heart's electrical activity, or an echocardiogram to visualize the heart's structure and functional performance. Furthermore, home blood pressure monitoring using an upper arm cuff is strongly encouraged to obtain more frequent and reliable measurements outside of a clinical setting. Prevention and management, empowering your health journey. The good news is that high blood pressure is largely preventable and, once diagnosed, highly manageable. This can often be achieved through lifestyle modifications alone or in combination with prescribed medications. Adopting these healthy habits can significantly reduce the risk of developing high blood pressure and effectively control existing high blood pressure. Losing excess weight and watching your waistline is one of the most effective strategies for controlling blood pressure. Even a small reduction in body weight can yield significant improvements in blood pressure readings. Regular exercise is recommended, aiming for at least 30 minutes of moderate physical activity on most days of the week. Consistent aerobic exercise such as brisk walking, jogging, cycling, swimming, or dancing has been shown to lower blood pressure by about 5 to 8 millimeters Hg, and incorporating high-intensity interval training and strength training can also provide additional cardiovascular benefits. Eating a healthy diet, adopting an eating plan rich in whole grains, fruits, vegetables, and low-fat dairy products while limiting saturated fats, cholesterol, and added sugars can lower blood pressure by up to 11 millimeters Hg. The DASH, Dietary Approaches to Stop Hypertension diet, and the Mediterranean diet are exemplary eating plans proven effective in blood pressure management, emphasizing foods rich in potassium, calcium, and magnesium, which help balance the effects of sodium in the body. To effectively reduce sodium intake, it's advisable to carefully read food labels, choose fewer processed foods, avoid adding table salt during cooking or at meals, and prioritize home cooking using herbs and spices for flavor. Limiting alcohol consumption is crucial, as excessive drinking can directly contribute to elevated blood pressure. Guidelines recommend men should limit themselves to no more than 2 alcoholic drinks per day, and women to no more than 1. Quitting smoking is essential, as tobacco use significantly increases the risk of high blood pressure, heart attack, and stroke. Quitting smoking is one of the most profoundly impactful actions an individual can take to improve their cardiovascular health. Getting enough sleep is paramount for overall health, including optimal heart and blood vessel function. Establishing a consistent sleep schedule, creating a conducive and quiet sleep environment, and avoiding large meals, nicotine, caffeine, and alcohol close to bedtime are key strategies. Managing stress is also highly important, as chronic, unmanaged stress can contribute to elevated blood pressure. Practicing effective stress reduction techniques, such as prioritizing tasks, focusing on controllable issues, identifying and avoiding stressors, making time for relaxation and hobbies, and practicing gratitude can be highly beneficial. Medical treatment. For many individuals, lifestyle modifications alone may not be sufficient to achieve optimal blood pressure control, necessitating the integration of medication into the treatment plan. The decision to initiate medication, the selection of specific drug classes, and the establishment of target blood pressure levels are highly individualized processes, determined through close collaboration with the healthcare team. A common blood pressure treatment goal is often below 130/80 millimeters Hg. For those with coexisting conditions, such as cardiovascular disease, chronic kidney disease, or diabetes, certain medications may offer superior benefits. If blood pressure remains persistently high despite the use of multiple medications, including a diuretic, the condition may be classified as resistant hypertension, requiring further investigation for potential secondary causes. Maintaining open and ongoing dialogue with the medical team about personal goals and preferences is absolutely essential for long-term success in blood pressure management. This section highlights the power of proactive, integrated health management. It consistently emphasizes lifestyle changes as a primary preventive measure and a fundamental cornerstone of treatment, often preceding or complementing pharmacological interventions. The detailed, actionable advice on diet, exercise, stress, and sleep illustrates that blood pressure management is a multifaceted, ongoing commitment that extends far beyond routine doctor visits. The strong emphasis on collaboration with the care team and maintaining open dialogue underscores shared responsibility and the personalized nature of effective management. This integrated approach empowers individuals by demonstrating that they have significant agency over their health outcomes through consistent, informed choices. It also frames medical intervention not as a sign of failure, but as a personalized, evidence-based tool within a broader, proactive health strategy. The synergy between self-care and professional guidance forms complementary pillars for achieving long-term success and optimal well-being, reinforcing the principle that being informed truly makes all the difference in one's health journey. Conclusion: empowering your health journey. In summary, high blood pressure is a common and dangerous condition, precisely dubbed the silent killer because it often presents without symptoms while gradually damaging the body. A fundamental step in safeguarding one's health is understanding blood pressure readings, what constitutes normal, elevated, and hypertensive stages. The long-term consequences of uncontrolled hypertension are severe and far-reaching, profoundly affecting the heart, brain, kidneys, and eyes, potentially leading to life-altering complications such as heart attacks, strokes, heart failure, and vision loss. The cumulative and interconnected nature of this damage across multiple organ systems underscores why early detection and consistent management are so crucial. While some risk factors such as age, genetic predisposition, and race are beyond an individual's control, a significant number of contributing factors, including diet, physical activity levels, weight, alcohol consumption, tobacco use, stress management, and sleep habits, are within one's ability to influence and manage. This understanding empowers individuals, transforming a seemingly overwhelming health threat into an arena where personal agency can make a profound difference, especially when uncontrollable factors highlight the increasing importance of careful lifestyle choices. Regular blood pressure checks are indispensable for early diagnosis, as this remains the sole reliable method to truly uncover this silent threat before significant damage occurs. There are compelling reasons to remain optimistic about blood pressure management. By diligently adopting healthy lifestyle habits, such as consuming a balanced diet, engaging in regular exercise, maintaining a healthy weight, limiting alcohol intake, abstaining from smoking, effectively managing stress, and prioritizing sufficient sleep, individuals can significantly reduce their risk of developing hypertension and effectively control existing high blood pressure. When necessary, medical treatment, meticulously guided by a dedicated healthcare team, plays a vital and personalized role in achieving and sustaining optimal blood pressure goals. The journey toward better health is a collaborative endeavor. Maintaining open and ongoing dialogue with the medical team, proactively asking questions, and remaining fully informed are paramount. One's health ultimately lies in one's hands, and being informed truly makes all the difference in navigating this journey successfully.